Uh, and yes, we are recording so that everybody knows. So thank you for coming this morning. Welcome to Nothing About Us Without Us. This is a critical reflection on community academic partnerships as seen through the lens of harm reduction advocates. I'm Lori Andrus. I'm the Associate Dean and Associate Professor in the College of Population Health. And I wanted everybody to know that I'm new to New Mexico, new to University of New Mexico, and I'm humbly presenting these ideas with the understanding that I'm going to learn and exchange with you all, possibly change my views and gain some new knowledge and insight. So thank you so much for being here and being willing to participate today. So, you know, the word critical reflection, critical has been thrown around a lot in the last 2 years or so. And so one of my colleagues said to me, you know, what is a critical reflection and why are we focused on harm reduction advocates? Why not some other population? And so I wanted to take a minute to talk about this notion of a critical reflection and what it is. A lot of us in academics throw those terms around, a critical reflection. I think for me, when I think about this concept of a critical reflection, it means that I'm going to challenge traditional ideas, our notions of what is evidence, what is data, how do we develop our knowledge, and we're going to kind of pick it apart and think about it. And so critical reflection, I think, is an important tool. And I think it makes you more humble, especially as an academician and a researcher, when you're able to stand back at a 30,000 foot level and look at what you're doing. And then why are we using harm reduction advocates for this exercise? Why didn't I pick some other population like low-income families who experience food insecurity? As I said earlier, doing this project with harm reduction advocates, it was one of the first times that I heard embodied the idea of informed refusal. Now, informed refusal is a term that was developed by Dr. Benjamin. She's a sociologist at Princeton, but she says that it's just as it's people's right to have an informed consent, you can have informed refusal. And what I heard loud and clear from the harm reduction advocates is that they consider it their responsibility and their right and an assertion of their autonomy to be able to say, no, we don't like that project, or no, we don't want to engage in that research. And instead, we'd like to do this. We want to shape the project in this way. And it made me think about the importance of that notion for oppressed populations. And it also made me wonder about other groups who might clearly say, no, we don't want to do that research project with you, or no, we want to look at a different question. But it was the first time I heard it clearly articulated, and it was through the harm reduction advocates that I worked with. So I'm going to quickly introduce our panelists. Most of you probably looked at the website, and so you know who our panelists are. But we have Katie Evans. And I'm going to ask Katie if she will just say hello, because I think it'll change the screen, right? So Katie should show up on the screen, actually.
Hi, folks. Good morning, everybody. Thanks for having me today.
Thanks. Katie's been working to improve community health outcomes in Baltimore for 10 years, with 6 of those years as a licensed social worker. In 2019, she transitioned from providing individual care to harm reduction program management, running a nighttime mobile outreach program aimed to support street-based sex workers. She has now transitioned to a consultancy, and her consultancy is called Gray Matters. Katie was very insightful when I did my interview with her, and I'm really pleased to have her on the panel today. Morgan Farrington, who you briefly met, pronouns they and them. Morgan, are you with us?
Yes, how are y'all? My name is Morgan Farrington. I am currently in the middle of a move. formerly in Alabama, headed to Florida to work in prep navigation with the state. So up to now, they've been running a harm reduction organization the last 3 years.
Thanks, Morgan. I did meet Morgan while I was living and working in Alabama, and learned a lot from them as well. And I'm happy that she was able to join us. I think she's in Florida with Tim right now. They're at a conference. Mariah Grant is a human rights and migration expert with a focus on sex workers' rights, freedom of movement, and labor exploitation. She's currently a freelance consultant working on projects related to sex work, decriminalization, sex work in humanitarian crisis and conflict zones, and human trafficking prevention and service provision for survivors. I want to say I learned a lot from Mariah too, but I will have to say that about everybody. So I'm just going to stop saying it. There was so much that I experienced and learned from talking with these folks. Ashley, are you there?
Yeah, I'm here.
Thank you.
Hi, I'm Ashley Charzik.
Yeah, a lot of you all may know Ashley. I think she's from the Albuquerque community, and she's the founder and executive director of New Mexico Harm Reduction Collaborative, located here in Albuquerque. Ashley prides herself on using her lived experience with substance use, poverty, and street life to advocate for people who use drugs. And she's been featured in publications and media endeavors as a voice of New Mexico's harm reduction movement. I've been very fortunate to meet Ashley only recently, but she has been very open and extended herself and expanded my learning about harm reduction here in Albuquerque. So I'm just on the edges, just meeting Ashley, and then also meeting you folks who showed up here today. Emily, were you able to join us yet?
Yes, hi everyone. Hi Lori.
Hey Emily, so Emily was born and raised in rural New Mexico. She's the Senior Director of State Advocacy and Criminal Legal Reform in the Office of National Policy at the Drug Policy Alliance. In that role, she leads DPA's state advocacy efforts and efforts to decriminalize drugs for personal use and build health-based alternatives. She was instrumental in starting the second law enforcement assisted diversion program in the nation. Do you guys know Emily? And then Tim, who you've met also, Tim's pronouns are he and they. He has over 30 years experience in harm reduction. He's a co-founder of Prevention Point Buffalo, the first syringe services program in New York State outside of New York City. In 2018, Tim gave up the city life and moved to St. Augustine, Florida, looking for the good life is what I'm going to say. That's what I think about people who go to Florida. He founded St. Augustine Harm Reduction Collective, and he's been very busy. He subsequently was a co-founder of Florida Harm Reduction Collective in 2019, where he now serves as Director of Outreach and Networking.
Good morning, everyone.
Thanks, Tim. So I want to go over some key terms and ideas and kind of set up the problem for today. And these are some of the ideas that I've already talked about earlier, but just to focus in on them for a minute. So it's the notion of informed refusal as equal to informed consent. We talk a lot about informed consent. It's almost a given, like we're going to do informed consent, you're going to sign these forms, we're going to consent you, and then we're going to put your consent forms in the database, and you're enrolled in a study. But we never think about the flip side of that, which is informed refusal. So once you go through the process of consenting people, consenting groups, they would have the right to say, no, we don't really want to do this, or we want to do it a different way, or we want to do another project. The notion of cognitive justice just caught my attention when I first learned about this idea in the last 18 months. But I think it's significant, and it also features in some of the research that I've done and the models that I've developed on health equity. And it's the models that I've developed on health equity start at the top, and they are about the cognitive models in any given place that determine how we perceive information and how we name it. So it's the cognitive models in our head. Isabel Wilkerson kind of refers to these in her book that she wrote. And she says that these cognitive models are like being in a dark theater, someone flashes a light and they show you to your seat. And it's really kind of subconscious. They help you name and identify phenomena, and you're not even aware of it. So cognitive justice is important if we're going to achieve social justice. So we're tackling social enablers that create stigma, discrimination, patronization, criminalization. Last, I use the term community academic partnerships because there are a lot of different forms that community academic partnerships take. So there's PAR, participatory action research. There's CBPR, community-based participatory research. There's like 10 or 12 different names. And it depends on what country you're in and what discipline you're working in. But all of them come under the larger heading of community academic partnerships. And then where I'm going is with this notion of community-led partnerships. Can we move and expand what we do with regard to our community academic partnerships so that they are more community-led partnerships, not just around research, but also around projects that are of interest to the groups. So our objectives for today, pretty simple. We've talked about a lot of these, but we want to think about how academic institutions can be of greater service to oppressed communities, different models of community engagement. So we'll talk a little bit about a biomedical model, and then a 21st century model, challenges to academic partnerships from the perspective of our harm reduction panelists. And then we've explored these concepts: informed refusal, power imbalances, and academic partnerships from the perspective of harm reduction advocates. So setting up the problem, what are we really talking about? And let's look at this from a different perspective, lay some more background around it so that we can continue to think about it. So we all agree that systems like UNM value community engagement within the research process. But as with most R1 systems, it's often hard to determine which master the university serves. Is it research that employs community engagement, or is it the needs of the community, which may or may not involve research? The point of our inquiry today examines how the research mission of large academic institutions attempt to avoid exploitation of oppressed communities while striving to meet the research goals set by other systems that determine both the research questions and the funding available. So admittedly, we all agree that these academic institutions try to balance community needs against the funding priorities set by other systems. But we continue to see the results of this over and over. Communities continue to be locked in cycles of poor health. Communities continue to be locked in cycles of low wealth. And we've heard loud and clear from oppressed groups that issues, needs, and problems from those communities persist. The upshot is that many community academic partnerships find it challenging to center community voices, needs, issues, and the lived experiences of oppressed communities. My experiences cross over government, politics, and now higher education. The most important constant across all of those areas, government, politics, and higher education, is the notion of community participation. However, there's a difference in government and politics, right? So the informed community always has an out. They can vote, they can organize themselves, they have the capacity to engage and disengage. But the research mission of higher education, the appeal for community engagement, is different. It's a little confusing and it can be confused. So think about it. The appeal for partnership is made to oppressed groups who oftentimes have low civic capacity. The appeal from the institution seems to come from a place that should be trusted to have nothing but the best intentions. The appeal from the institution makes it seem like they are solving a complex, really bad health problem. And the appeal from the institution makes it clear that only trained experts can figure out the solutions. But now, in the 21st century, the divide between what is a mysterious, highly complex health problem And the solutions have really narrowed, right? So we know, especially in public health, where we're focused on non-medical determinants of health, that a lot of the solutions are upstream and they fall outside of healthcare and they fall outside of public health. And so community groups plus other non-health agencies and sectors of the government are converging to show us non-medical structural solutions where communities can and should have a voice in what gets addressed. It was after talking to the harm reduction advocates that I found how and why this academic version of community engagement works against the needs of oppressed communities in some cases, or in many cases. I think in HR advocates, what I found was a clear expression of the right to social justice based on societal changes to attitudes and cognitive injustices that perpetuate stigmatization. I also found from the HR advocates that they demanded to be treated as equals, that they demanded to have a life while striving to control drug use or be free from sex work or additional drug use. The HR advocates demand to have a right about the issues and what happens to them in academic partnerships. And they make it clear that they have the right to say, no, we don't want to do this. So today, what I wanted to do was start to reimagine how community academic partnerships may be reformulated so that research becomes less of a priority or research expands to include projects that are representative of the needs of the community to help them solve crucial issues of importance to them. So our agenda for today is going to focus on community engagement, panelist questions and discussion, and then we'll have a closing challenge. Emily's going to deliver our closing challenge. So on the screen, you have the ladder of citizen participation. So let's do a little bit of level setting with this ladder of citizen participation. So as I said earlier, this was created in the 1960s by Sherry Arnstein. She's a sociologist in the UK, a British sociologist. And the ladder of community engagement is a kind of metaphor for ascendance from the simplest kind of citizen participation to the best at the highest level. So there are 5 different levels. So at the very lowest level, she called that information. And you can kind of think about this as the basic level of information that you have to share to maintain transparency and to run a democracy. So it's very basic. Give you the facts, just the facts. We'll be transparent, and here's the information. As you move from that basic level, you move into consultation and involvement. And in consultation and involvement, you gather feedback, opinions, you might do a survey. The community is not sure what happens to the information. So they gathered the survey, they maybe held a focus group. But you know, the information kind of drops into a black box. There's no two-way communication. You move up to involvement and co-creation. And at this point, you have a two-way street. So the entity communicates with the group, they take information back from the group, they engage in dialogue, there's interaction, and they may sit on board, they may participate on planning groups, but the full authority still lies with the organization or the government. Last, at the highest level of citizen participation is empowerment. And in this case, trust is required. There's two-way communication, and the community group has veto power. What I did in this next slide was to overlay our 20th and 21st century ideas of community engaged research with the ladder of citizen participation from the 1960s. And so along the left side of that slide, you see the biomedical model of community engagement. Then you see CVPR. And then last, you see what I'm calling community-led participation. And so this is the evolution of health research as it relates to this ladder. So looking at the lowest level of the citizen participation ladder, we see the clinical health medical perspective. And at this lower level on the ladder, what I've asserted is that this is a biomedical model of community participation. So under the biomedical model, we ensure that medical and healthcare decisions, practices, drugs, and clinical practices are trusted by the community and work well. That's the whole rationale behind this biomedical model. We're going to invite you in, you're going to be representative of your group, and then that ensures that our practice, our intervention, our clinical outcome, whatever the drug is that we produce, works for that community. And you've participated based on your social characteristics. It's not sure that you're co-equal partners. You're working on narrowly defined issues that refer to biomedical problems or healthcare issues as opposed to problems central to the community. So we now have some research that demonstrates that this biomedical model can be responsible for the transmission of stigma, the incorporation and maintenance of discrimination and racial bias in institutions, and the development of additional health disparities across minority groups. And so from there, we've developed this community-based participatory research. So we're going to the middle of the ladder. And at this level, we're focused on involvement and co-creation. So we see CBPR, and we can see that it's more of a two-way street. But here, again, the full authority still lies with the organization and the government. The research is still first. The research is still mostly about health issues and not upstream factors. And what's interesting to me, I guess, about the CBPR model is it's hard to gauge structural and systemic change. So it sets up a nice dynamic between the academic system, the researcher, and the community. But what's the outcome? Are we changing systems issues, structural issues, issues that are of importance to the community? So at the very top, again, you have empowerment in Arnstein's ladder. And so this is why I've proposed community-led partnerships as the future. Here, the institution focuses less on research and the funding priorities of other systems and more on the needs of the oppressed community groups. Does anybody have any comments or questions at this point? We're going to move into the panel discussion. This is an example of a quote from some of the folks that I interviewed. And I really like this quote. I put it up here because I wanted something that was representative before we moved into the panel discussion. But in this case, what you see is this notion of power differentials. And so what the advocate is saying here is that we have all these things we're trying to do for our clients. We're trying to deliver these services, much needed services. And so the research academic partner comes in and says, well, can you do this survey? Can you line up, 40 people and ask them these questions, deliver this survey, get the survey back, help us figure out or interpret the survey. And all of that takes away from an organization that might have 2 staff people. So needs of clients go unmet, or there's a sacrifice, there's a buy-off, a trade-off. And so really that was one of the other ideas that struck home with me and the kind of research that I typically conduct. So I want to go ahead and bring in the panel now and begin our discussion. So what do I need to do to bring the panel up on the screen there? Yes. Yeah. Okay. Great. Thanks, everybody. So when we first started talking, we had a discussion early on, back in October, and we discussed this idea of your experiences working along a continuum, right? So it was the idea that some of you might have started out as subjects, and then you moved into the research process. You might have become co-participants. You might have sat on community advisory groups. And now some of you are actually research partners. But I wanted to go through and have each of you kind of talk about your journey. your participation with researchers or academic systems and what that experience has been like for you. What are you doing right now? What has changed over time for you on your journey as you started out kind of working in this academic partnership setting? So I'm going to start with Katie, because Katie helped me think of this question when we first started talking. Katie, how are you today?
Wow, how are you?
I'm good. So why don't you tell us a little bit about your journey, and what you were doing and what you're doing now?
Sure. So I started in an unconventional way in harm reduction and in research simultaneously. I became interested in the program that I most recently worked for because of the work that they were doing. And I realized that they were part of a larger institution. And the reason that that structure was in place was because the program was started as a research project, which by no means is a conventional way to start a harm reduction program. And I'll also plug that I would not recommend starting a harm reduction program that way, because it means that the institution that's doing the research also essentially owns or has like ownership of the harm reduction program, which in turn means that the harm reduction program will never be sustainably run by community. So just to put that out there, my participation in it is not an endorsement of the model. So the research initiated the program in 2017, and the research ran until 2020, although there were other smaller research projects along the way. So the initial study was looking at how does a low barrier harm reduction program change health outcomes or impact health outcomes, things like rates of transmission of different infections and things of that nature, for people who do street-based sex work. And then there were smaller studies along the way looking at the impact of PrEP. And there are plans to continue doing research, although I no longer, as of the end of the summer, work with that organization. My role kind of changed in response to those different studies. So initially I didn't have a lot of participation, but then whenever they started the PrEP study, being that I was running outreach at the time, I was asked to help engage participants in research, which is not something that I'm particularly fond of, because you have this one moment with somebody in the middle of the night on a street corner and that person is at work right now and you're asking them to participate in something else. But that was, given that the funding from the program relied on research funding, it also influenced what we were supposed to do to a degree. And then towards the end of my time with that program, a lot of my job was management of all of our programs. And so therefore, a lot of my job was kind of running interference between what the goals of research were and what the aims of service provision were. And the aims of service provision were informed by what participants were asking us for, what staff were motivated to do, and where their kind of niches were, versus the aims of research are a little bit more sterile. It's like, we want like clean cut data in the beginning and we want clean cut data in the end. So we want you to move in this way. Whereas the program that I was aiming to run was a lot more nimble in responding to the needs of people. So towards the end, a lot of my role was trying to be the person to pump the brakes really on research, while not completely pumping the brakes on our funding, because there was that messy kind of research harm reduction relationship. So like she said, it was a spectrum, and mine doesn't really have a clear spot, but it was very intertwined.
Thanks, Katie. Mariah, what are you thinking about? What's your journey been through the work that you do and how you've interacted in academic partnerships?
Yeah, so the first thing I think of is about almost 15 years ago, I was working on my Master's of Human Rights at Mahidol University, and it's a university outside of Bangkok, Thailand. And I had the great fortune of working with an organization called Empower Foundation. It's one of the oldest sex worker-led groups in the region in Southeast Asia, and they did a lot of original research. And through my dissertation, I was looking at the types of research that they were doing, the models that they were using to assess anti-trafficking legislation within Thailand and its impact on sex workers. So my history in academic spaces has really been to look to the groups that are from the community. At the time, it wasn't necessarily using the terminology community-led, but it was just a group that needed the data to demonstrate to policymakers why legislation that in theory was meant to reduce harm in various labor sectors was actually causing significant harm, especially to migrant sex workers within the country. From there, I've worked within many sex worker-led organizations as well as anti-trafficking organizations. But most recently, I was the director of research and advocacy with the Sex Workers Project of the Urban Justice Center. Lori, when you and I met, I was in that role. And within the organization, I don't come from a sex worker background, but it was a majority sex worker led group. So all of the research projects that we would undertake, even though I was overseeing that division and that program, I really leaned heavily on the folks within the organization who had sex work experience to ensure that what we were doing really was also community driven. And then I was able to build partnerships with academic institutions and be really mindful of ones where I felt that they valued community-led initiatives and were also going to be good stewards of research that was not going to be then harmful to the populations that we were working with. I was able to forge a relationship with the Global Health Justice Partnership, which had previously done work with SWP and has modeled how to work with sex worker-led organizations within their community. So it's through Yale's law school and public health school. So we were able to do research that was coming from the communities that we worked with and was based on the expressed needs of those groups. So we were looking at district attorney policies and ways that we could reduce harm and leverage the research that we were doing to build better policy. I'm now, as you said, a freelance consultant. So with that, I've had many opportunities to go back to kind of my beginnings and find those organizations that are sex worker led who are doing their own original research. One that I worked with recently is the Global Network of Sex Work Projects, which doesn't rely on necessarily relationships with academic institutions that are frequently gatekeepers within this field. And they do their own research, which has been critical in a number of different ways.
Mariah, what I remember from talking with you, because I kept getting confused, because you used the term research, but we talked about trusted entities versus academic entities who do research. And so for you, research is about who the partner is, the nature of the partner and their interest, right? And I think you turned down one project or something.
I turned down a lot. Like I would get emails regularly asking for partnerships with SWP to send out surveys or to identify people for interviews. And I would review the proposals. I would ask how the research project was informed, in what way it was engaging with the community, because we were a nonprofit law firm, so our legal team was always representing clients. And so these researchers would come to us and ask if we could send out their survey to our clients. And our legal providers, their first priority is the best interest of their clients. And very secondary to that is potentially doing a research project through the program that I was overseeing. So I was really mindful of both balancing not me being a gatekeeper and me being preventing people from doing research they might want to participate in, while also not potentially putting people in harm's way by having them participate in research that could be really detrimental.
Yeah. Morgan, we met in Alabama, and at the time you had partnerships with someone in an academic system, but you will talk about the work that you all were doing. We'll talk about your journey first, but then the work that you were doing around policy and the legislature in Alabama?
Oh, okay. Honestly, the first research-based connection that I made was with a harm reductionist researcher. She was harm reduction first and came into research. So I was fortunate in that way that I was kind of handled, I was sort of babied a little bit the first time because it was somebody who got it. They understood the needs of me and my program and the people that I was serving. And so their motivations were still very much for the people and less about their project. That being said, though, the policy research was, for lack of a better term, like it was very like kind of militant. They were very much about their schedule and their funding and it was nothing about my needs or the needs of my participants was really acknowledged even until I had to like really put my foot down and say things like can't have people come to a 2-day focus group and not compensate them. Like a turkey sandwich at lunch is not enough. You're asking people to travel and spend 2 days worth of their time out of work and doing kind of eyeball bleeding level boring stuff for you. And you've got to pay them for that. You have to. These are people who need every dime they can get, and you're asking quite a lot. And they were just flabbergasted. I mean, minds blown for that the suggestion of that. And I was kind of taken aback, but I mean, there was a lot that they didn't think about. There were many things that they didn't think about when asking the community to participate with them. Because this went above and beyond just dealing with my clients, my participants. This was a community-wide research thing. So this focus group was completely unprepared for what my team brought. And that was really difficult to navigate in terms of just the days rather that we were there. I could go on, but I'll save you. I'll spare you that.
I think one of the things though that I was struck by in Alabama was that you were working on legislation, the creation of legislation and the passage of legislation. And I think that was a priority for you, was it not, in Alabama?
Very much, because most of what traditional harm reduction even does is illegal there. There's no civilian distribution of naloxone. That's outright illegal. There's no syringe exchange. That is illegal. So you have to get very creative. Fortunately, harm reduction can be any number of things, but you have to get really creative if you want to sort of, I guess, if you want to be considered harm reduction in the traditional sense. You have to offer education and sort of be a resource hub for a lot of different services. And that means being really well-rounded, which means being really busy.
Yeah. And you had a staff of how many?
One. It was me.
Right. But you were also very well connected in Alabama. I remember that. So you were a staff of one, but in the state of Alabama, you served an important role and were well connected with the resources and the people you needed to be connected with.
For certain, kind of looked at myself as like a madam, like a services madam,
Yeah. Got it. That makes sense in Alabama. Let's see, Tim, you've had quite a journey and you're doing quite a bit of work, I think, now inside of the system. But can you talk about where you started and how you moved closer to the partnerships that you have now?
Yeah. I would sort of go back to, like, I think that my start with the experience of research and stuff was not so much as a subject of research, but an object of research. Seeing a lot of data that was being published by researchers that was not informed by the community at all. Just raw statistics saying that we were folks that were more likely to get HIV from either sharing injection equipment or unsafe sex, or other things that were sort of like detrimental and stigmatizing to us, and we had no input in how that data was being collected or disseminated, and no opportunity to respond to that data as well. Researchers would just blast it at a conference, and we would be made to sit there in the audience and sort of like look at it. From there, I also, participated as a research subject in quite a few studies over the years. But many of those were not informed by the community as well. So for instance, researchers would sort of look at these as opportunities to educate me about my behaviors, and sometimes to even sort of maybe unknowingly, but shame me about my behaviors. One of the first studies that I took part in was one of the early AIDS vaccine studies, in which I talked about openly my risk for my sexual behavior to HIV, and the researcher was sort of like shocked that I had an HIV risk, even though I was in an HIV vaccine study. So it's sort of like a disconnect between the community and what we might do as individuals and the research that they were doing. So I just started to get involved. I sort of have a reputation for having a big mouth. And I would just sort of get involved by standing up and challenging researchers that were presenting data about, where they got that data from. What was the community participation in design of this study? And so now I do serve on a couple different research sort of boards. One is people with lived experience in research, and that's with the American Institutes of Research. I'm also a consultant on several University of Miami studies, and recently took part in a University of Washington SHARP study on looking at data indicators for syringe services programs. But I still would, like to also start by interrogating the word research. And what I'm seeing now and continuing to see in these partnerships is that academics and those with the funding seem to have an ownership of the word research that isn't sort of, it's realistic, it's gatekeeping, it's paternalistic. People who use drugs, people engaged in sex work, we're doing research all the time. And we're doing real-time research where we're talking to participants, we're even doing research on ourselves, because the drugs that we're buying are not necessarily a known substance. It could have anything. And we're implementing that research almost immediately. And the lag between, what we're doing in the field and what research is studying and publishing, we often get to the point of where academics are publishing data, and we've already known that. We've already known what they're going to tell us long before that data gets published. So, trying now in the fields that I'm working in, the organizations that I'm working in, is trying to get researchers and academics to like lighten up a bit, and level the playing field. We do need to be partners in this. We do have, those of us who are involved in harm reduction do have a lot of questions about what's going on. And often those questions, the questions that we get approached to help answer, we've already had the answers to them for a long time. And we need folks to move on and to like listen to the community and involve us in research design, put us on IRBs, help us, we can help you develop the questions that you want to ask folks, that you're going to get real answers from. Many of the questions I've been asked over the years, I haven't responded truthfully, because I've responded in the way that I think you want to hear, or in the way that I want my community to be seen. So that's sort of what I'm doing now with this couple boards that I'm on, and seeing some progress, and hopefully more.
Thank you. Emily, do you have an observation you want to make now? I'm kind of using Emily as my 30,000 foot level person, but Emily, do you have a comment right now?
And no, I mean, I just, it's really fascinating to hear all the comments because at Drug Policy Alliance, you know, we have a Department of Research and Academic Engagement, and we're really trying to bridge the divide between research and effective drug policies. And part of that is really convening researchers to discuss, you know, emerging policy issues, but it's also about facilitating sort of dialogue between researchers and communities. So a lot of what I'm hearing from the panel is very much aligned with what we're trying to do to really change the drug research landscape by engaging, you know, community-driven drug policy research. And I'll talk a little bit about that later, but I guess my only comment is hearing folks in the field is very much aligning with what we're hearing and what we're trying to do to facilitate sort of that dialogue. Thanks.
Ashley, we've had some good conversations and I've heard some really interesting stories from you. But I wonder if you wanted to share some of your experiences out in the field and your encounters, maybe with the state, if you can talk about that and how that meshes with your ability to provide services in comparison to what the state might want you all to do.
Yeah, definitely. So just to give some background, I am one of the founders and currently the executive director of New Mexico Harm Reduction Collaborative. We are a low barrier drop-in center located in the International District in Albuquerque, and we see roughly anywhere from 30 to 50 people a day for just harm reduction services, MAT navigation, case management, Hep C testing, things like that, all the general things that you would expect. And in the state of New Mexico, where we are located, one of the main items that we are not able to give to the community because it's still illegal and it's still paraphernalia is glassware. So some of the really big barriers that we've faced is not being able to, you know, try and get funding through research grants about, you know, safer smoking or using glassware because there are legal boundaries that we can't cross as a harm reduction organization. And so we've had to, you know, kind of get more creative with what we give out to the community and making sure that they still have these safer smoking items, even though we cannot afford them or, you know, even legally really hand them out.
What do you think makes it difficult for you all to get that point across? Like, is there, what's not being heard? Or
I believe that some of the difficulty is that when the laws are made or when the regulations rather are made by the Department of Health, the regulations have to go through different I believe an advisory board, and then there's I believe actually another board that they have to go through to get passed. But basically the law here in New Mexico is that the New Mexico Department of Health are the people that can say whether or not an item is legal to give out. So they are the ones that decide through advisory boards and through their own leadership what items you know are considered harm reduction items, or what can they say has you know, or what is there a need for rather. So when that law was passed in 2021, which was House Bill 52. It was the legislation that gave the health department this ability. We're now they're the deciders, and we don't, you know, have to make new legislation to ask for new harm reduction items like pipes or things like that. But again, we still haven't gotten the regulations, and it's very difficult to know who makes the regulations and kind of how the process works. I believe there's not really a lot of transparency to the community. There may be for people who are working in harm reduction and very close to the Department of Health. But when it comes to community members who are trying to find alternatives to injection, and they're trying to find, alternatives to, maybe something that's given them bad experiences, like having had limbs amputated due to injection injuries and things like that, but they still want to exercise their bodily autonomy to use substances, and then being told that they cannot, we can't give them something that would make the difference in their health and wellness, because we would be, facing potential jail time if we handed that out.
So maybe a show of hands, but to what extent do you feel that stigmatization blocks the ability to make progress on whatever it is that you're working on? Like, how many people still feel that there's stigmatization going on? Yeah, Katie, you had your hand up.
Yeah, I just wanted to add for the glassware that Ashley was talking about, to be more specific, at least to where I am in Baltimore. We're talking about pipes that are used to smoke the crack version of cocaine, and we're talking about pipes that are used to smoke meth. And the reason in Maryland, and I would assume across the United States, that those are not allowed is because the use of crack is associated with Black people and people of color, and the use of meth is associated with like heavy poverty. And that's why in Maryland, we're allowed to hand out sniffing kits for cocaine, no problem. Smoking kits for crack, big problem. So it's not just like oppression broadly, but it is specifically racism and thinking about the impacts of poverty plus drug use, and not just like drug use, because white people inject drugs and we're comfortable with that enough to say that syringes are legal in Maryland. So I just want to be more specific in case people aren't familiar with what like glassware means or what pipes mean and what drugs are used for.
Yeah. Mariah, I see you shaking your head. You have some familiarity with this kind of narrative?
Yeah, I mean, I was just also thinking about in terms of sex work and stigma. It's not just the stigma, but it's the criminalization of many forms of sex work, especially in-person sex work across most states and jurisdictions in the US. So it's not just stigma that is preventing people from being involved in research or leading research and being open about doing sex work, because I know many people who are, they have different hats and different experiences, and they're researchers who have also done sex work but aren't able to lead with the fact that they've done sex work, or are able to get through graduate school or undergrad by supplementing their income with doing sex work. And so there's this sort of belief that there's researchers over here and then there's research participants over here. And part of the work that I did at SWP was to try to bridge that divide and try to break down those ideas of there being a silo between those two different communities, because we knew and worked with a lot of researchers who had that sex work experience but were at risk of arrest or at risk of having that experience used against them in a custody battle if they were a parent, or if they were somebody who was going to school on a visa and came from another country, that by disclosing that they were doing sex work would put their visa at risk as well. So there was myriad reasons, not just stigma, but stigma combined with criminalization that made it much more difficult for those communities.
Morgan, I see your hand up, but I want to make one point. So it gets to be tricky, right? It's like a chicken and an egg. So there is stigmatization and then there's criminalization. Do you work on changing the law? Can you get the law changed if the stigmatization still exists? Right? So that's this idea of cognitive justice. So where do you work? Can you actually pass the legislation, change the criminalization of an activity, or must you also deal with the narrative, the discourse, and the cognitive models that create stigmatization. Morgan, you had your hand up.
I want to speak to that you just mentioned, but first I wanted to say that to the comment that Mariah made, there's so much stigma about sex work in general. Like, it is okay to be a dancer as long as you're doing it to put yourself through school. You're not allowed to just do it because you want to or because you like it. Right, like that's always the thing that I hear. That's always the story around it, is like, oh, I just put myself through college. It's never just like, oh, I did it because I was a good stripper, because I liked it, because I enjoyed it, because I was good at it. It's never an excuse you get to hear. An excuse, you have to excuse it. That for me is problematic, right? That you even have to give somebody an excuse. Like, I fried French fries because I needed money. Right? You don't have to excuse French frying, but you do have to excuse being in sex work, and that's a problem for me. And Lori, to your question, living in the buckle on the Bible Belt, I think that no, you can't change laws before you fix stigma, but fixing stigma, because the law is a direct result of the stigma, right? So you have to fix the stigma or address the stigma or change it or whatever before you can ever get the laws changed. But it really helps if you're living in a place where people believe in science or numbers at all. Like,
Right.
in somewhere that's so backwards can just make that whole process excruciating.
Tim, is your hand up, and then we'll go to Emily.
Yeah, and I mean, I would say about, the stigma criminalization thing as well, is sometimes we do change laws in a good way. And we can have syringe distribution programs or such, but that doesn't change the stigma or the systemic racism that mean that some people still don't have equal access to that the protections that law may give. We still know and hear often of folks getting arrested for possession of syringes, while they're on their way to a sanctioned needle exchange program. And often those folks are Black, Latinx, or look a different way than society thinks they should. So stigmatization they both have to go hand in hand. The decriminalization is just a part of it. So we have to focus on both simultaneously.
Emily?
Yeah, I mean, I was just going to agree with what Tim said. I think, though, it's really important to work on policy change because, dismantling the decades and centuries of stigmatization and sort of the pathologizing of people who use drugs is really hard, but we can start to change. I think policy change can lead to some destigmatization, and I think we need to even think beyond just decriminalization. We need to think about safe supply and regulation and some of those policies, because until we really go there, we're still going to see some stigma.
I'm going to use the privilege as a host for this, because I think we might have some other public health people participating or people who are interested in other topics, but working in West Virginia with poor families, low-income families, right? So interviewing the academic and the healthcare community, there were high levels of stigmatization and discrimination. And so that's when you find that people think that you're just ignorant. You don't know what to eat. Like, it's not that you don't have enough money. It's not that you don't have a car or you have a refrigerator. You just either don't know how to cook or you don't know how to shop for groceries. And so kind of uncovering that kind of stigmatization and the idea that you're just unintelligent and don't know what foods to eat was an important part of the research that I did. But the levels of stigmatization from the healthcare system, as well as just the other folks who worked around that area, nutritionists, community health workers, people at food pantries, they stigmatized the clients that came in for those services. So I want to ask one more question, and then I'm going to open it up to the folks in the audience if we can. So I'm going to be asking my team out there how we do that. But get ready for your questions. You could put them in the Q&A, but I think I might ask people to unmute if I can and just ask their questions. But here's my last question for each of you. If you were to design a program or a project or research, either one, program, project, or research, what would you create? What would you want to have done that is something that you are really thinking about? And Katie, I'm going to start with you because you really moved way out. And so, you know, you got out, and in the sense that I got from you is that you just could not take it anymore. Like, it was so hypocritical to your idea of the mission that you wanted to serve. But what would you create, program, project, now as you think about it?
Yeah, so I'll say that hypocritical is not the word that I'd want to associate with that program, but I did realize towards the end of my time there, I was experiencing burnout, which is not new for me, but it was the first time that I think I was looking for more critical lenses to understand why this was happening again. And I learned about the characteristics of white supremacy culture for the first time, which part of me is embarrassed that it took me to this point in my life to learn about them, but we're here nonetheless. And it almost felt like a checklist that I was moving through of like, this is how our program operates. And these are the characteristics of white supremacy culture. And I'm like, yes, we're doing this and this and this. If you're not familiar, I can find a, or maybe one of the folks from UNM can put a link in the chat. But one of the characteristics is quality or quantity over quality. And what happens in, I think, a lot of white-led organizations is we get really excited about the numbers and about the reach, and we praise each other a lot for the numbers and the reach. And that was something that was pivotal to my time there. When I started, our outreach program had 250 encounters a month. By the time I left, we had 1,400 encounters a month. And so people are like, yes, you're doing it. And I'm not doing it solely. So that was something that I felt like I was correcting a lot. But also, the quality of the services was also, in my mind, subpar to when we had the fewer encounters, because when we had fewer encounters, we had a drop-in center and we had a buffet of services available to folks. And that changed because of COVID. But because all of this energy was pivoted towards outreach and doing deliveries and doing home-based care, it was taken from the drop-in center. And I will say, if you have the opportunity to design a program doing services that are like home-based, and by home-based, I really mean like alley-based, car-based, abando-based, McDonald's bathroom-based, do it. Because if you start a program and you want to sit in your office all day, then like do that. But also the best way to provide care is to go where somebody is. I mean, everybody loves delivery, and that applies to harm reduction services too. But I wish I had the opportunity to, I wish the research funding led itself to doing more quality work. For example, we had a home-based buprenorphine program, also known as Suboxone, which is a medication-assisted treatment that's offered for folks, and it was fantastic. But we only had the funding to do it for part of one day per week. And the funding that was coming in was for reaching more areas, but really it should be for giving more people access to that service by having the provider there more days per week. And it should be allocated towards like having more folks to help connect people to those services, having more case managers to help people support through those services, having more like levels of care available to people. Because I think one thing, I was talking to somebody else about this other day, and there is a strong theme in, I think, predominantly white-led harm reduction organizations or other social services, where we just want to like get a basis and reach as many people as possible. And that does serve people who are relatively stable well. Like if you've got a house full of people who are using together, they might just need a drop-off of syringes, and that's great. But when thinking about services that are really meeting the needs of people beyond people who are stable, are really just like the white community, we're thinking about like a better depth of services. So though I'm not in a position right now where I think I should be designing anybody's services, and I would rather leave that to people who are who have more lived experience, I think that that's something that I would do completely different if I had the opportunity, is to really push back when I was getting all of that praise about you're doing it, you're reaching more people, and feeding into that rather than thinking about like, but what is the end goal? Like, is the end goal just to hand someone a syringe and walk away, or you know, have a small meaningful interaction, or is it to like really truly build relationships with people and do more advocacy work so people have access to housing and things of that nature.
Yeah.
So
Yeah, I think that's important to me. Another one of my big obsessions is what counts as data and evidence. And the more you count it, the more you cover up experiences. And as you said, quality. So just because you're counting something doesn't mean it counts, right? I think Einstein said that, or somebody said it, or maybe they said the opposite, I don't know. But adding up numbers doesn't mean that you're doing something of quality. And Katie, if you have a link to that you can drop in the chat, please do that, and or send it to Nikki. You could email it to Nikki and she could drop it in the chat. Who wants to go next? Who has an idea about a project or program that they would like to see designed, put on the table? Morgan, yeah.
Him beat me to it. Let him go first.
No, you go, Morgan, and then we'll let Tim go.
Fine. Honestly, I would love to see a couple of different things. The original question being if I could design a program, what would it look like? I mean, it would basically look like wraparound services for people who use drugs, for people experiencing homelessness, people doing sex work, whatever, without anyone having to necessarily recognize themselves as such. So I don't feel like we're ever really going to be like accepted as members of communities until we don't have to come out, right? People don't have to come out and tell you they're not drug users. People don't have to come out and tell you they're not gay. People don't have to come out and tell you they're not a sex worker. Why should I have to come out and say any of those things, right? So I don't feel like we truly get acceptance until we don't have to say those things about ourselves. So offering wraparound services to clients who say that they need them. No questions.
Yeah, I like that. There's an American sociologist when I first started studying social determinants of health, and I was looking at the UK in comparison to the United States. And this sociologist says that America has an obsession with how much, who do we give it to, and for how long? Because God forbid we make them lazy, right? So we means test everything. Should we really help those people? Should they declare, their need? Don't help them too long, because then they'll become lazy and they'll become dependent on it.
Right.
Those
And
that declaring,
that whole prosperity gospel thing kind of ties in with that, and I can't with that mess. So that is what that would look like. But research wise, I think what I would like to see, what I would try to create is research that is not dependent on morality politics, in order to be funded, or some kind of popularity contest, or somebody trying to get tenure or whatever. Because what I see is a lot of the same information that, as Tim said, that we already know. We've been knowing for a long time. I see the same information getting disseminated from different, vaguely, slightly, barely different research methods over and over again. What I don't see is anything changing. What I don't see is anything surprising. And I don't see enough. I don't see enough shift happening in methods, in action, in anything.
Yeah.
So for instance, right, like in HIV world, everyone has the status quo, the general consensus is that, African American and gay men are the number one primary, like, in need of services for HIV services. I would beg to differ, or at least I'm afraid that it's not true. I'm afraid that there are large swaths of populations in various regions that are not getting HIV services because they don't know that they need them, because they're not getting tested. And it's really scary to see that the pendulum might be swinging the other way very soon. Everyone needs them. I'm not saying that we need to divert any services that are being given out at this point. I'm saying that we might need to shift the way that we're talking about things, and leaning on the research is maybe putting out the wrong message, because the research is only going to show what participants of the research are telling, right? But we
Yeah.
don't have straight white yokel dude showing up to these HIV services research things. We have researchers that are going to gay bars and researchers that are going to specific communities and engaging with those communities. So of course those communities are who's showing up in the research.
Yeah.
We are not getting engagement from your average typical Joe Blow nobody guy, who doesn't check any of the boxes on the marginalization forms, right? So, and look, I'm not trying to be sitting here and advocating for like the white man, right? That they don't need me to do that. But my concern is that, as we all know, like boo boo does be rolling downhill. So like, if straight white rich dude is not being treated, tested, prevented from, then who's gonna be in the trickle down from that? Everybody's at risk, right?
Yeah.
Concerned that the research isn't showing this danger, this potential, because they're not being paid attention to.
You're absolutely right about that. As I was leaving West Virginia University, we were sitting on a powder keg in the state of West Virginia. They had not started to reveal the numbers that demonstrated an increase in HIV/AIDS in the state of West Virginia, but everyone at the state health department kind of knew it, but they really weren't talking about it. Tim, what are you thinking about?
I think, I don't have any idea what research I would like to see done. And I think that if you are somebody who's going to be engaging in research and you do have a research idea, but you haven't spent a very large amount of time listening to folks who use drugs, listening to folks who are engaged in sex work, listening to gay men and involved in chemsex and things like that. If you haven't done your field work and just sat in a room, kept your mouth shut, and listened to what's going on in the community, then you shouldn't have a good idea for a research project either. And sort of to what Morgan is saying, the perpetuation of the same study, the use of the same data over and over again to tell the community things we've already known for decades is getting very tiresome for us. So if I were to think about what I want to do as far as research or as far as a capstone project or anything, I would probably say that you've got to spend maybe a year volunteering at a syringe access program or at an overdose prevention site, and listen to folks. What questions are they asking when they come in for their services? Right now in Florida, we're hearing a lot of questions about xylazine and wounds around xylazine. And there's not a lot of research going on yet about xylazine, and it's probably going to be a couple years before academic institutions get wind that we need to get a lot of data on what's going on and a lot of information about what's going on with xylazine. So, I don't have any ideas for what research I'd like to see.
Thank you for your humility, Tim, and that message. I think it's pretty significant. Ashley, what are you thinking about? We discussed something that you were interested in. It was a pretty sophisticated idea, but what are you thinking about, program, project, or research at this point?
Well, the thing that I would like to see would be the possibility of again going back to safer smoking products like pipes, for example. Is I would like to see us, as in our just our harm reduction community, being allowed to give pipes to people and give more injection alternatives, whether that's not even glassware, like going into other possible alternatives being funded. Like right now we do have foil, for example, but there are other, tools and things that we could put into kits that we don't give out. But I'd like to see things like pipes funded, and then coming back and doing focus groups to see if this was something that gave people, a better sense of autonomy, a better sense of wellness, and also being able to hear from the community, because I know that pretty much talking to anybody that does this line of work, one of the most difficult things to fund is usually getting things like meth pipes and crack pipes. And if we were able to just have the ability to give out what we needed, and then to find out what the implications of that are, down the line with people's health, like, do they feel like as if they've had a better experience with getting wraparound care as well, because of, okay, well, now I don't have to go from place to place trying to find a pipe. I can just come here and use the services here without, like trying to run off to the next place right away. I would like to see, what people who use drugs have to say about those experiences and what that would look like for them in the long run.
Yeah, so you were talking about a small pilot where you would track that, and you wanted to create like a small kind of pilot group, and then actually do give out the material, and then come back to that same group and talk to them about the use of that pipe or that certain paraphernalia. Morgan, before I go to you, let me ask Mariah what she's thinking about in terms of project, program, or something that she might create.
Yeah, thank you. I also just want to uplift what Morgan was saying earlier, that nobody needs to justify why they're doing sex work. I 100% agree, and that the reason that you do it is of no significance, that it could be talent, it could just be necessity, it could be whatever it is. And for there not to be stigma, truly, we need to accept that people can do that work for a variety of reasons, and it's really none of your business. So if somebody wants to do it, that's great. And I fully support folks doing sex work for whatever reasons they have for it. I also, in terms of a specific project, I tend to agree with everything that Tim was saying. If you're a researcher and you think you have a good idea, but you haven't, either you're not from the community that you're wanting to do research about, or you haven't spent a year plus more sitting with the folks and hearing from them, then you don't have a good idea. I would also say that what I'd love to see is a massive transfer of wealth and funds to organizations that are community-based, community-led, and that money can be used as they see fit. And that I think a lot of very good research ideas come out of groups that are doing harm reduction, or groups that are doing harm reduction in combination with policy advocacy. I have worked with folks implementing, we've done research on district attorney policies and non-prosecution policies, so like hyper local level policy change. And there are small community groups throughout the United States that I've been luckily fortunate to work with, even after leaving SWP, on a project to actually implement the handbook that we put out before I left. And there's so much incredible work being done at that local level. And I would love to see that if organizations are working on changing district attorney prosecutor policy so that they are using a sort of harm reduction model around the criminal legal field to stop prosecuting people for laws that are deeply unjust, that we also get the information out of those jurisdictions that's going to be necessary for long-term change in policy, for decriminalization efforts, for increasing funding to harm reduction groups, for seeing that as a necessity within the public health field, with revolutionizing and changing our criminal legal system that has been deeply racist and deeply harmful to communities throughout the history of this country. So I would really, really like to see money go towards these organizations, and perhaps it's money in combination with training from academic institutions if those groups don't have the research background and are looking to get it, so that they can then run their own research. So that's sort of one thought that I have that I would love to see. And I think a lot of that money could come from, especially when it comes to sex worker rights, anti-trafficking groups that claim to be doing work in the name of the well-being and health of sex workers, but in reality has been extremely harmful for many decades. And millions, billions of dollars have been funneled towards anti-trafficking organizations who have done scant anything to really stop harm, and in fact have actually caused a significant amount of harm to people who are involved in sex work, whether that be because of trafficking or whether that just be because that's their job. So if you're looking for where the funds can come from, that's my first idea.
Yeah, I had some ideas about that. I was visioning around that. Morgan, can I go to Emily, or you have a burning comment? You always have a good comment. What do you think?
Oh, no, go ahead, please.
Okay. Emily, you had your hand up.
Yeah, I was just wanting to reflect for a moment about both what Tim and Mariah said. I mean, I think it's important for us to recognize that in other countries around harm reduction, there's been decades of research done. And sometimes I see in this country that we feel like we have to recreate those. You know, an example is around overdose prevention centers that have been in existence for 3 decades, and lots of evidence, peer-reviewed evidence, research showing that they work, but we feel like we still have to do that here. And so encouraging us not to recreate a lot of the research that's already been done, and really looking at more sort of pushing the envelope policies and programs when it comes to drug use and harm reduction. So, and then to Mariah's point, I mean, I think there's less research done on sort of the decriminalization or the what a lot of, not a lot, but a handful of prosecutors are doing around the country that are, declining to prosecute. How are those programs actually, how are we evaluating them, and how are we engaging community to help us evaluate them? Because those are new models in our country. It's not, that, and so I would love to see more research around that, because, just lifting up what's happening in Oregon, being the first state to decriminalize drug use and possession, unfortunately, politics are coming into play, and we're seeing, those types of policies being blamed for every social ill or public disorder complaints. And so I would really love to see research go in that direction. So I just wanted to add that.
Nikki, is it possible to bring people up or unmute them? I think I've asked you that like 3 times, and the answer is no.
They can raise their hand, and
Okay.
I can allow them to speak.
So you can see their hands raised, or?
Yes, if someone from the attendees tab wants to come up on mic and speak, they can raise their hand,
Okay.
and I can allow them to speak.
So if anybody wants to ask a question, can you raise your hand? I think we have a way of seeing it, and we'll unmute you so you can ask a question. I do have some comments in the Q&A. And I'm gonna get to, maybe I'll go ahead and answer one of these. So there's a question about how to encourage university systems to equitably support community funding for the time spent in our research participation. So I was giving some thought to that, and I looked at a couple of models, and the one that stuck out to me the most is from the Netherlands. And in some universities in the Netherlands, it's a horrible name. I think it's called a science shop. But I'm thinking about universities taking about 1% of their administrative fees, creating an entity where the community comes in and they say, this is our need, this is our question, this is our problem, we want to work on it. And then the university assembles a team who wants to work on that problem with the community, and the university puts up the funding for it. So in this way, the activity, the participation of the university is not controlled by systems who determine the research question, systems who pay for the research to be done, and more research that doesn't exactly get at the needs of the community. So the university would really have to create and fund off some of its money to create this community front-facing center, where the community comes in and says, this is our problem. We want to think about how to solve this. And then the university assembles a team and pays for that activity to happen. So let's see. There is another question about what have been some impactful participatory dissemination strategies that you've seen where participants aren't just looking at the research they contributed to, but are actually having some ownership of how it's being put out there. Morgan, did you have your hand up while I was at the start?
I saw Tim's hand.
Yeah. Tim, did you have a comment?
I just wanted to the last question, you know, and that is, you know, universities and research institutes can also hire people with lived experience and, you know, hire by, you know, a living wage and benefits and retirement funds and all that lovely stuff, not just contract with us. And then to answer like another question that I saw in the Q&A is universities and academics can stop pretending that people with lived experience can't be objective in research studies that they may want to conduct or participate in. We've done a lot of work advocating within the harm reduction community for our folks to be in positions of leadership and to not just be outreach workers and peers. And only to have them get to those positions and be punished for their lived experience as somehow not able to be objective on the stuff that they're doing. And it's like, that's sort of like also an infantilization of people with lived experience. You don't know how to, you know, how to exercise good judgment. You know, so I think universities really need to kind of like take a look at that.
Yeah, I
you
think
know,
that's a good point. This whole notion of objectivity in research is a man-made creation, right? So in order to be objective, somebody had to come up with the standards for objectivity. And anything man touches does not guarantee that it's objective. People build things based on their socialization and their training. They decide what to include, they decide what to exclude. And so there is no pure objectivity. And so having people with lived experience involved in a project does not undermine our supposed objectivity, based on everything that I have learned. Is there another comment? I'm going to go ahead and invite Emily to make some comments at this point. So Emily, you have the floor.
Oh my goodness. Well, first of all, I just want to share how interesting this conversation was and how important it is to hear from folks who are have lived experience, who are doing the work, who are in community. And so, Lori, thank you for bringing this incredible group together. I also want to just preface my comments with, I'm not a researcher. I also am not a direct service provider in harm reduction. I work in policy, but a lot of the themes that I heard come up today are very relevant in the work we're doing to translate research into policy and working with community. You know, for those of you who don't know the Drug Policy Alliance, you know, we're working to end the war on drugs and really build non-punitive, equitable systems, right? And we're people, you know, in this policy space that are impacted by the drug war. We've lost ones to overdose. We're in recovery. We use drugs. We've experienced harms of drug criminalization. So I just want to share that's where I'm coming from, is a organization with folks who are working in the policy space from all of those different perspectives. But as I mentioned earlier, we also felt that it was really important in this policy work to bridge that divide between research and effective drug policies. And that means really facilitating a dialogue between researchers and community. And so it was really exciting to hear this conversation. I'm very pragmatic, so I'm sort of thinking through like what things I was left with in this conversation, and where we all, as whether we're researchers, academics, community members, people who use drugs, policy folks, I think it's really important that we leave today with, you know, some questions or some ways to get involved. And so, you know, obviously, I think we need to continue facilitating dialogue between researchers and community. I think that's super important, that there's a space where we're creating forums to discuss sort of emerging issues, so that we're not, as you know, we heard from the panelists today, continuing to, you know, feel like we have to research everything, or, you know, also hearing from community about what issues and emerging programs should be evaluated or researched. I think we need to find a way to mobilize academics and researchers around these important policy issues. So even just hearing, you know, the question, Laura, you asked, like, what programs would you like, or what issues would you like to see research, I think is a critical question that we need to continue to ask. I think convening researchers and people who use drugs to develop evaluation instruments is really important, and hearing that today. And that's something that we've done, and you know, I'm happy to drop in the chat some of that work. But it's really important that metrics are being developed in consultation and led by communities. I think, you know, asking what role communities can play in creating and owning new research methods and ideas is an important question for us to ask. And then I also want to just say, and this came up because it was something I was thinking about before, was that, you know, it isn't an us versus them, this idea of like academic institutions and people who use drugs or harm reduction providers, because we know that, you know, there's a network of drug researchers with lived experience who are incredible and have so much to offer. And so sort of how do we, and I heard this being raised, like how academic institutions can hire researchers with lived experience, or that researchers with lived experiences feel safe to identify. And I think Tim was mentioning, which, you know, the idea that people who use drugs are not necessarily biased, and that we should be open to recognizing that people with lived experiences can be engaged directly in research. And then I think the other thing I would say is just the funding and sustainability of programs is really important. And how do we think about funding people with lived experience in their work, in the research, in those partnerships, and building sort of sustainability for continuation. And so, yeah, I'm happy to share. It was in 2022 when the Drug Policy Alliance, the Urban Survivors Union, and the Network of Drug Researchers with Lived Experience, we hosted sort of a 4-part virtual series where we were, the title was Beyond Participatory Based Research and Innovations in Community-Driven Drug Policy Research. So I'm going to drop that link for folks who might be interested, where we were really encouraging drug researchers to think critically about their relationship with people who use drugs, and how do we provide drug researchers with the tools to really authentically co-lead research with community. So those are just some thoughts. I feel like those are some questions or some thoughts or some places we need to go. But I really enjoyed this conversation and ideas that I'm going to bring back to our incredible Department of Research and Academic Engagement, because this is completely aligned with the work that they're doing. So thank you, Lori.
Thank you very much, Emily. I'm going to go to Morgan and then Mariah, and then I'll check, see if we have more questions, and I have some closing comments. Morgan, what's on your mind?
So I think that there's maybe some cause here to just say, like, flip this around. If you want to be able to involve community more effectively in your research, then stop disallowing them from calling themselves researchers. There's this continual divide between the researcher, like the us and them thing, right? It's the researchers and whomever you're researching. But we have our own things that we would like to find out. And the more we're told that we cannot because we're not academics and we're not this and we're not that, the less we're able to do, right? You keep going to communities and telling them that they're involved, but then telling them that they can't be also because they're not researchers. Well, bullshit. Yes, we are. Each and every one of us, just because we don't have degrees or couldn't, I mean, let's not sit here and forget that most of the communities that we're researching don't have access to higher education. Meanwhile, they're being told that they can't do these things, and they're like being, like Tim said, kind of infantilized by being told that they're not allowed to participate from a research perspective. They can only be researched. They're being blocked from learning and discovering these things on their own. So where's the training? Where's the gate in? Where's the path into this? Start training these communities to do their own research about their own issues so that they can probably come up with their own solutions. I mean, we're not so incapable. We've been dealing with like the worst forms of marginalization and the poverty and the stigmatization of our existence this whole time, and meanwhile like are still alive. So clearly we can handle some stuff. Let us in.
Good points. Mariah.
I also just want to express so much gratitude to the folks on this panel and everything that's been expressed today and just the knowledge that's represented here. Emily had also mentioned, there's much that we can learn from outside of the US context, and I totally agree. When I was with SWP, we were able to put together a research guide on ethical practices to research projects in the sex trades. I am happy. I don't think we have a chat, but I can provide the link if folks are interested. It's on the SWP website. So it's just swp.urbanjustice.org in the resources section. There we relied heavily on other guides, other research that's been done significantly outside of the US that's been led by groups that are sex worker organizing efforts, policy advocacy organizing efforts, harm reduction groups. So just wanted to uplift some of that work. I know I had mentioned Global Network of Sex Work Projects at the top of this call, this discussion. But there again, it's an organization that is based on their membership that are majority sex worker led organizations from around the world who are creating new ways of doing research about the folks for whom they represent. And they have a wealth of resources as well. Many of their resources include the methodologies that they've used. In terms of the question on dissemination, I think that they've done just a really excellent job of producing research and publishing a variety of different types of text. So instead of it being a extremely long report that is hard to sift through and not that useful, they've come up with creative ways of sharing information both in the written word and in videos and other types of text, using infographics, using things that are easily shared on social media, so that we're not valuing one type of publication over any others. That's something that I really learned from when I was at SWP and tried to recreate when we were publishing the district attorney handbook that I'd mentioned earlier. So creating a community guide that is brief and to the point and is something that folks can use as a standalone document for education within their own organizations, or be something that they use within advocacy as well. So thinking creatively, if you are producing research, how is it going to be the most useful? And one of the things that we talk about in the research guide itself is that there tends to be this reluctance to not publish within a peer-reviewed journal that's behind a paywall, especially within academic settings, where it becomes really difficult for folks to use that at the community level. So not prioritizing academic aspirations over the utility of the actual data that is produced in a research project. So I wanted to just uplift that as well.
Can they put things in the Q&A for people to see, Nikki? Like links to different things? Can the panelists put stuff in the Q&A?
Good.
Yeah, so you guys could go to the Q&A and put in links to some of the things that you've mentioned. I want to, I think, close out. I'm open to additional comments or questions, especially from the folks who are online. But I want to close out with a couple of ideas. One is sustainability. And so I think it's worth giving some consideration to how R1 institutions or academic institutions can either expand the R to projects and programs or do less of the R and more of the issues that are of concern to communities that we profess to be concerned about. And so really, I think that means looking really hard at the funding, the investments, the money that we take in administrative fees, and try to figure out if any of it could be used to fund this kind of community front-facing structure that will work with communities and then assemble the resources to work on the issues that the communities are interested in. There was one project that I encountered since I've been here at UNM, and it hasn't been that long, but I was part of the challenge, the research challenge grants through the president's office. And there was a project that was looking at housing, affordable housing in Albuquerque, big issue in Albuquerque. They had assembled a huge group of people from different agencies from all across Albuquerque and the county to look at housing. They wrote a really phenomenal application. They pulled in academicians, they pulled in people from different places around UNM, and then they pulled in community groups, and they all worked on this application. I sat on the panel that evaluated the applications. I distinctly remember people saying, well, that's not research. They didn't even get ranked. They didn't get ranked because it wasn't research, but they were looking at a really important issue to the county, to the state of New Mexico. This group then wrote an application to HUD, and I remember looking at the HUD. Federal grants are so mysterious. It's like you need a whole nother set of people to decipher them and tell you how to respond to them. And again, this is through my lens. They didn't get the HUD funding either. But again, I mean, think about the issue of affordable housing in this region and how important it is to a lot of different groups, but it wasn't research, so it didn't rank. And that kind of thing just sticks out in my head. The other idea that I think is really critical is this notion of stigmatization, and what are we doing, the people who are in power, in control, running the studies, running the programs, and running the projects. Are we subconsciously, with our cognitive model, stigmatizing people and creating projects and programs and research that keeps them subjugated or sees them as people who are out of control? Your behavior is just out of control, and we've got to police you. We've got to make sure that whatever we do in response to you keeps you in control. And that's a form of stigmatization, patronization, saying that you have no autonomy and no freedom, and that you just can't participate in this area because it's so highly complex. And so I understand a lot of the points that you all have made. As for this group and this work, we are writing a paper together. So I've said that to you guys. I haven't said it in a while, but we'll be writing a paper. I cannot promise you that it will not be peer reviewed or in some fancy publication. I will do my best, but everybody will participate because I think it's an important message. And as I've said many, many times, I've learned a lot in just having conversations with you all. And I think that what you say crosses groups, oppressed groups, but you say it most loudly, most clearly, and with the most conviction. And I think those are important messages. So with that, I'm going to close us out and say thank you. Thank you to the people who have stayed on and listened, and thank you to the people in the room. And I did not ask if anybody in here had a question or a comment. Well, thank you for being here and listening. Yes, we have one person in the back. I apologize. state your name and your question or your comment.
Oh, yeah, just, my name is Billy Zibeti. I work for the city of Albuquerque. We have the Office of Equity and Inclusion that also addresses similar issues. I'm trying to bridge, the relationship of collaboration between the city government and the university.
Yeah.
Apparently, we tend to operate like in silos in the same community. And that's why I came to kind of glean some of the things you were discussing, because our office also handles similar things. And I worked on this campus for 4 or 5 years, and I have a good understanding a bit of what happens. So my comment or just question is, what next after today? Does the conversation end here or begins here?
So that's a good point, and thank you for calling my attention to it, because I ended with a peer-reviewed publication, right? So there it is, academician writing something that benefits her, saying I'm going to include you guys. So apologies for that. We are who we are, unfortunately, right? I try hard to be different. But his question was, what happens next? What do we do next? And that is really important, right? So what kind of problem are we working on? Is it just something that academic systems should be working on? And the answer is no. We've got to partner with other sectors like the city government, and this gentleman is from the city government. And so in what would happen next, I think you would seek out other systems at the university that are working on these kinds of problems, but we need to reach out. And I say this a lot. I say it especially to public health people. If you look around the table and all you see are public health people, or if you look around the table and all you see are your peers from your own system, then you're not going to be able to do the work adequately. So if you don't have somebody from the city, you don't have somebody from the county, you don't have somebody from different levels of government, and you don't have somebody from the public education system and transportation, and all of these others. So you all talk about wraparound services. The wraparound services really are about bringing together different sectors of government, different social service agencies. They have a new name for that collective impact. They were talking about collective impact a couple of years ago. But there's got to be these multi-sector partnerships. And I almost think they can never be too big. But again, if you're working at a table and it's just your people at the table, then you haven't thought structurally or systemically about that problem, because no problem exists in isolation. It just doesn't. You're going to have to reach out and work with other groups. So good question. Let me think about it. Let me find out exactly what you're interested in and what groups should be working with you. Because this is the conversation I just had with the state health. Thank you very much. Appreciate it. And thank you to the folks that were online. Okay. Thanks, everybody. Talk to you guys soon.